If you frequently experience sneezing, a runny nose, itchy eyes, or nasal congestion, you might be dealing with allergic rhinitis. This condition, commonly known as hay fever, affects millions of people worldwide. It can be triggered by allergens like pollen, dust mites, pet dander, and mold. While allergic rhinitis is not life-threatening, it can significantly impact daily life, leading to sleep disturbances, fatigue, and difficulty concentrating. In this video, we're going to explore what allergic rhinitis is, its symptoms, causes, how it's diagnosed, and the best ways to manage it. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Allergic rhinitis is an allergic reaction that occurs when your immune system overreacts to allergens in the air. Normally, the immune system protects the body from harmful invaders like bacteria and viruses. However, in people with allergic rhinitis, the immune system mistakenly identifies harmless substances, such as pollen or pet dander, as dangerous. When these allergens enter the nose, the immune system triggers the release of histamine and other chemicals, causing inflammation and irritation of the nasal passages. This results in classic allergy symptoms such as sneezing, nasal congestion, and watery eyes. There are two main types of allergic rhinitis, seasonal and non-seasonal. Seasonal allergic rhinitis, commonly known as hay fever, occurs at certain times of the year when specific allergens, like tree or grass pollen, are in the air. Non-seasonal allergic rhinitis, on the other hand, occurs year-round and is usually caused by indoor allergens like dust mites, mold, and pet dander. Allergic rhinitis symptoms can range from mild to severe and may vary depending on the type of allergen involved. The most common symptoms include sneezing, which often comes in bursts, and a runny or stuffy nose due to inflammation of the nasal passages. Many people also experience itchy eyes, nose, throat, or ears, which can be particularly bothersome. Watery, red, or swollen eyes are also common, especially in people with seasonal allergies. Since nasal congestion can make breathing difficult, some individuals develop postnasal drip, where mucus drips down the back of the throat, causing irritation and a persistent cough. Other symptoms include fatigue and difficulty concentrating. This is often due to poor sleep caused by nasal congestion and discomfort. Some people also experience sinus pressure or headaches, especially when allergic rhinitis leads to sinus inflammation. These symptoms can be mild for some people but severe for others, interfering with work, school, and daily activities. If left untreated, allergic rhinitis can contribute to complications such as sinus infections, ear infections, and worsening asthma symptoms. The main cause of allergic rhinitis is an overactive immune response to allergens. But what exactly triggers these reactions? The most common triggers vary depending on whether a person has seasonal or non-seasonal allergic rhinitis. In seasonal allergic rhinitis, pollen from trees, grasses, and weeds is the main culprit. Tree pollen tends to be high in the spring, grass pollen is more common in late spring and summer, and weed pollen, such as ragweed, peaks in the late summer and fall. Non-seasonal allergic rhinitis is caused by allergens that are present year-round. Common triggers include dust mites, which thrive in bedding, carpets, and upholstery, as well as pet dander, which consists of tiny flakes of skin and proteins found in pet saliva and urine. Mold spores are another common trigger, especially in damp environments like bathrooms, basements, and kitchens. Cockroach droppings can also be a source of indoor allergies, particularly in urban areas. Environmental factors such as air pollution, smoke, strong odors, and weather changes can sometimes make allergic symptoms worse, even though they are not allergens themselves. If you suspect you have allergic rhinitis, a doctor can help diagnose the condition based on your symptoms, medical history, and possibly allergy testing. During a consultation, your doctor will ask about the frequency and duration of your symptoms, whether they are seasonal or year-round, and if they seem to be triggered by specific exposures, such as being around pets or spending time outdoors. A physical exam may be performed to check for signs of nasal inflammation, such as swollen nasal passages, and to rule out other conditions like sinus infections or nasal polyps. If needed, allergy testing may be recommended. This can include skin prick testing, where small amounts of common allergens are applied to the skin, usually on the forearm or back. If you are allergic to a substance, a small red bump will appear. Blood tests, such as specific IgE tests, can also be used to measure the presence of allergy-related antibodies in the blood. While these tests can confirm allergies, they are not always necessary if symptoms and triggers are clear. Managing allergic rhinitis involves a combination of avoiding triggers, using medications, and considering long-term treatment options like immunotherapy if symptoms are severe. One of the best ways to reduce allergy symptoms is to minimize exposure to allergens. If pollen is a trigger, staying indoors on high pollen days, keeping windows closed, and using an air purifier with HEPA filters can help. For people with dust mite allergies, using allergen-proof mattress and pillow covers, washing bedding frequently in hot water, and reducing carpets and upholstered furniture can make a difference. If pet dander is a problem, keeping pets out of the bedroom and cleaning frequently can help, though in severe cases, finding a new home for the pet may be necessary. Medications are often used to relieve symptoms. Antihistamines such as cetirizine, loratadine, and fexofenadine block histamine and can reduce sneezing, itching, and runny nose. Many antihistamines are available over the counter and are effective for mild to moderate symptoms. Nasal corticosteroids like fluticasone and mometasone reduce nasal inflammation and are considered the most effective treatment for persistent symptoms. These sprays take a few days to reach full effectiveness, so consistent use is important. Decongestants such as pseudoephedrine can provide short-term relief from nasal congestion, but they should not be used for more than a few days at a time, as they can cause rebound congestion. Other medications include leukotriene receptor antagonists like montelukast, which can help control allergy symptoms, particularly in people with both allergic rhinitis and asthma. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, for individuals with severe or persistent allergic rhinitis that doesn't respond well to medications, immunotherapy may be an option. This involves gradually exposing the body to small amounts of the allergen through allergy shots or sublingual tablets to build tolerance over time. Immunotherapy can be highly effective in reducing long-term allergy symptoms and may even prevent the development of asthma in some cases. In addition to medications, some lifestyle changes and home remedies can help manage allergic rhinitis. Rinsing the nasal passages with a saline solution using a neti pot or saline spray can help clear allergens and mucus from the nose. Staying hydrated using a humidifier and applying a warm compress to the face can also provide relief from nasal congestion. Dietary changes such as consuming foods rich in vitamin C, omega-3 fatty acids, and quercetin may have mild anti-inflammatory effects, although they are not a replacement for medical treatment. Managing stress and getting enough sleep can also help support the immune system and reduce the severity of allergy symptoms. Allergic rhinitis is a common but often frustrating condition that can interfere with daily life. Whether it's seasonal allergies triggered by pollen or year-round allergies caused by dust mites or pet dander, understanding the symptoms, causes, and treatment options can help you take control of your allergies. By avoiding triggers, using medications as needed, and considering long-term treatments like immunotherapy, many people can effectively manage their symptoms and improve their quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.